And now to further explore how providers, payers, and patient communities can work together to improve health care for everybody, I'm pleased to be joined by a panel of really great experts. At least I hope they're great. We're going to find out. Dr. Irfan Asif is Associate Dean of Primary Care and Rural Health at the University of Alabama at Birmingham School of Medicine. Virginia Fields is founder and CEO of the National Black Leadership Commission on Health. And Melissa Schulman is Senior Vice President of Government and Public Affairs at CVS Health. Transparency, I'm a client. I go to CVS Health. So, any pharmacy that's nearby. But great to be with all of you. Let me just start with Dr. Asif. Let me ask you a question. The law of the land is Obamacare. It is Affordable Care Act. And, I used to work on health care policy in the Senate in the 1990s. And at that time, we had somewhere around 13 major revisions in health care. But they really didn't increase the number of Americans that were covered by some form of health insurance. Obamacare did do that. It's left a lot of people still off the grid. But I'm wondering if we're going to take the law of the land and we're going to make it better so that it's more practical, that some of the glitches in it are fixed, that we find people having more accessibility in that. What are some of the things that you think would be advisable to consider from your perspective as a practitioner?
Yeah, that's a really great question. So access to healthcare is a major issue. And some of the things that we need to think about are how we can increase the pipeline of folks who can help with creating access. So the pipeline maybe of primary care providers that might be able to help with facilitating more access. But part of the issue is that if we don't have a system that's incentivized to provide that access, so if we have a fee-for-service model, we're not actually incentivized to prevent disease, and we're going to be incentivizing people to go into professions where they're treating disease rather than trying to just prevent it. And so again, trying to have a system where primary care is incentivized, I think that's the backbone of what we need to work towards. Some of the other things that I think we should include are really trying to change the payment model. So right now, the payment model is a fee-for-service model. And so we need to think of capitated systems or value-based systems that might be able to incentivize people to go into primary care. At the moment, particularly in Alabama, we have a huge shortage of primary care providers, and some of this relates to the payment reform.
Just before I jump to Virginia in the same question, when you talk about the shortage of workers, and I also want to I keep reminding everybody, we're not out of the COVID crisis. We're still in the middle of the COVID crisis. And I keep hearing about frontline health aides, frontline doctors, frontline nurses, those folks in there are leaving because of exhaustion, morale, et cetera, in this period of pandemic. Can you give us a snapshot of what the stakes are and what we need to do to get it right?
Yeah. Really...
Well, Virginia, give me a second. We'll get Dr. Asif, and I'm going to jump to you.
Sorry.
No worries.
Yeah, no, you're totally right. I think people are very stretched with what the COVID pandemic has brought to us. We're certainly stretched with physicians, staff, nurses, everyone on the front lines, as you mentioned. Hopefully with the vaccinations, people can start to see the light at the end of the tunnel. COVID has allowed us to do some unique things, though. When we think about COVID, it's brought things like telemedicine to light, so allowing us to have more access for people in other parts of states or across the country. You end up with some new issues, though, around potentially health disparities. For example, some people may not have access to broadband, so connecting to that digital health may be another issue that we have to tackle down the road. So for me, the framework that I think about in terms of addressing the needs, getting back to your original question, I think that a payment reform is important, having good access to care, as you alluded to, thinking about the workforce and not just of physicians, but the team that can take care of a patient or a populations, and that team might include nurses, physician assistants, behavioral health, social workers. I think digital health is a big part of this. So thinking about how we can provide access using our digital health technology.
Right.
And then accountability. So trying to think about ways that we can all work together, whether you're inside or outside the medical profession, to provide these services.
Right. Thank you. Virginia Fields, I'd love to ask you this, but I want to tell our audience that you're not only founder and CEO of the National Black Leadership Commission in Health, but you were also president of the borough of Manhattan, where I spent a lot of time 20 years ago. You're a member of the New York City Council, so you have a very tangible understanding of major urban centers and the health deficit. So let me ask you the same thing. What are the blind spots that we need to rectify in our understanding of how to fix the healthcare system today?
Well, I don't know so much about whether it will fix it, but one way of things that we can certainly do to get more people insured is directly related to political will and coming from the political side of it. Political will to move on some really good options that are out there that we heard about during the presidential campaign and we continue to hear about now through Congress. But we need the political will in order to get people insured. And when we look at, I think it's still about 12 states, mostly southern states, that have not expanded Medicaid, that creates dire problems for people living in those areas in terms of access to good quality health care. And with most of those states, at least six, over half of them being in the South, Alabama, Georgia, Tennessee, I think Texas, South Carolina, North Carolina, Mississippi, of course. People living in those areas, and COVID has certainly shown us that they are the populations also disproportionately impacted by all of these diseases that have made them more vulnerable to COVID. So it takes the political will to act that if those states are not going to expand, there are some options out there, including expanding Medicaid premium care for people who are below the poverty line. So just reading about a lot of this, and it takes a lot to keep up with everything that is going on because things are moving so fast. But I come to this from the standpoint of how do we get more people insured so that they can receive the help that they need. So political will is one thing. The second point I want to make on this issue is education. I think we need to have more comprehensive education directed to people who are uninsured about what options they have, about the benefits that are available, and helping them become insured, even to the point of helping them fill out applications. I work on the ground. My office, we're boots on the ground. So we see this. People do not know, even though there's a great deal of information out there about resources, services, and we make assumptions that everybody knows and that everybody is aware of this, but it is not true. So education, very comprehensive, not just at a time when medical plans are expected to be renewed the end of the year. So let's do more education and awareness, and we can use data to tell us, to show us the zip codes in the areas where we have large uninsured populations. Well, let's get in there and do some real work.
Virginia, I want to ask you a quick short form, and then I want to jump to Melissa, and then we're going to take an audience question. But you've said something so important, which is kind of address the information deficit that many people have about healthcare. And I guess I want to know, as we kind of talked about the politics of COVID and how it hit different communities disproportionately in America, this country spent billions of dollars, lots of money, to find trusted ambassadors, to find news ways, to find new ways to distribute and educate regarding COVID, particularly into communities of color and particularly into communities that were on the edges of the healthcare system previously, to try to make sure that they were reached. Is there anything they did that impressed you, or do you find what we did ineffective? And if you did find it effective, can we learn from it in achieving what you just said is so important?
Yes, it was certainly effective. Let's start with those trusted bodies in the communities, not only our faith-based institutions, but where people live, reside, where they go to barbershops, beauty salons, nail salons, wherever they are. Let's identify people in those spaces whom they trust. Daycare centers, people trust people in the daycare centers, and community-based organizations, because mobilizing communities is what we do all of the time. So now pivoting in order to do the work around COVID is very important and very effective.
Well, thank you. Melissa, CVS Health is one of the largest networks of provision of health goods. You're the front face of dealing with a lot of families. I think one of the things going to be a bit to what Dr. Asif just said, and also Brad Wenstrup, Congressman Wenstrup said, part of this is, promoting a kind of routinized, regular interaction of people with their health future, giving them agency. And I'm just interested in your perspective. You're trying to fix our healthcare system, the law of the land as it is. You try to, get more people in the system, get more people access to drugs they can afford and whatnot. What are the elements of that you think are important that we consider in fixing the current system we have?
Well, I think both Dr. Asif and Virginia hit on a couple of really important themes, but I noticed neither of them mentioned pharmacists. And there has been, I think, one of the things that we have learned from COVID is, one, I agree strongly, it's unleashed the power of what telemedicine can be.
Right.
And the broadband inequalities across the country is going to be key to making telehealth really work. But I think what we've also seen during COVID is whether it's somebody coming in to see their nurse practitioner at a minute clinic, or talking to their pharmacist, getting their COVID vaccination or getting their COVID test, is that companies like ours are really in every community. And the access that we can help provide to the people who need it is really something that we've seen used in COVID, I think, in an enormously effective way. Health equity was one of our guiding principles during COVID, as we looked at both testing and as we looked at vaccinations. So we were making sure that if we didn't have a facility in a community, then we stood up a community testing center. We made sure that as we were looking at vaccinations, particularly when the vaccine supply was more limited, that we were taking into account health equity as we were activating stores. But I also think that there are a number of provisions, with all due respect to Congressman Wenstrup, in the Build Back Better plan that actually do really help access. And Virginia hit on some of those, right? So whether it's additional funding to support people in non-expansion states who would not otherwise be able to get on the exchanges, the premium support provisions that are in the Build Back Better plan, again, which will help get people onto the ACA and help get them coverage, I think are enormously important, particularly right now. And I think the other thing that particularly our company is looking at is trying to provide care in the community in a different way. It's another way to improve access. So, for example, we're piloting mental health assistance in our health hubs in a few different states. So unfortunately, one of the problems sometimes with addressing mental health is being able to get to a practitioner. So we have a program where there's somebody in the health hub that can help you do that. I think the other thing to think about in improving access and helping with affordability is looking at different sites of care. So if you're an oncology patient, get your infusion done at home, as opposed to having to go to the hospital where you may be at greater risk for infection. Home dialysis is another growing area, again, whereby changing the site of care, you're not only increasing access, you're also increasing affordability, which helps benefit the system, not only from the point of cost, but more importantly, from the point of health outcomes, because people are actually able to get the care that they need.
Melissa, we have a question coming up. We're always out of time with these great conversations, so I want to come back and get you all to respond to our questioner. But I want to ask you, Melissa, I mean, you were considered one of the top congressional staffers at one point in your career in this health space. And I just want to ask you about the literacy of our Congress on these issues, and because I sometimes feel there's sort of a whack-a-mole game going on in healthcare, so that rather than thinking comprehensively how we get this ecosystem to function better, to fix what we've got kind of a lot of silver bullets is the wrong metaphor, but people looking for just one part of it. And I'm just wondering what you think can be done to up an understanding of the importance of getting a comprehensive picture right in the policy space in Congress versus, somebody having, fads that they care about. Does that make sense?
Yeah, it does. I guess I I would disagree with you a little bit because I think on both sides of the aisle, there are members of Congress in both the House and the Senate who are very invested in healthcare and healthcare policy. You know, it's certainly, it's not all of them, but it doesn't have to be all of them. And I think, you know, Congressman Winstrup, you know, the experience he brings as a physician to the conversation helps inform the debate. I think there are a number of expert staff on the committee and a number of expert members who have really made it their life's work as a public service to help improve the healthcare system. So I think that makes a difference. I would go back to both my time currently as a lobbyist, but also my time on the Hill. I'm a big believer in show and tell. We love for elected officials to come into our pharmacies and see how we are doing vaccinations, see how we're doing testing. Let them see how we have a savings program at the pharmacy counter to help people find a lower cost drug. Come and see what happens with a Minute Clinic. Let's show you what happens with our mental health. And as we're providing more and more primary care through our community presence, that's something we very much want members of Congress, the House and the Senate, and local legislators to come and see. You know, I think it's, and the same is true, it's taking the time to go visit your local hospital, to meet with the other healthcare providers in your community. I think all of that helps inform the debate. And then at the end of the day, talking with your constituents. They're the patients, they're the ones accessing the system, and getting their viewpoints as well, I think also helps to inform the debate. I am one of those who still believes that Congress is one of the greatest institutions and that an incredible amount of good can happen there. And I think that oftentimes the debate is far more elevated and far more informed than sometimes I think the public gives them credit for.
I think that's very fair. I think that's very fair, and I largely agree with you. Sometimes I wish it were a little more elevated, a little more informed, but we can agree to play with that on the edge. But we have a question from our audience.
We'll agree with that point.
Yeah. Okay. We have a question from our audience from Kevin Fahey. He's a consultant. Kevin?
How do we get to a system that is focused on improving people's health and the economy for everyone and not just those in the health business? Okay, that's a provocative question. Why don't I start with Dr. Asif? Dr. Asif, I think, and we never require people to agree with the question, but what are your views on how to make this about the patients in healthcare? And there seemed to be an implied criticism of the health business.
Yeah, you know, to me, the answer is to train individuals in the communities with which they're going to work. So a lot of training happens in places where it's access to a big medical system, but I'd love to get out into rural or other underserved parts of the state and provide training so that they get to know those communities. They're part of those communities, and as a member of that community and someone who's serving, I think if they're trained that way, they'll start to understand what are the issues that are commonly faced and be able to address those firsthand. And let me jump to Melissa real quick, and we'll end with Virginia. Melissa?
I mean, I work for a company that kicked tobacco out. So we think about the patient every single day. And so whether I'm talking to my colleagues at retail, at Caremark, or at Aetna, what we're focused on is improving the health outcomes for our members and for our patients every single day. That's what motivates our people. I work with amazing colleagues who have essentially vaccinated the nation. And that sort of spirit and commitment, at least at CVS Health, runs through every conversation we have. How does the member experience it? How do we make it better for the member? How do we help keep people healthy and get them healthy if they're not?
And Virginia, I'm going to give you the last word, but in this, I'm going to piggyback on this question and ask you something from your experience, because I find that some Americans, like our questioner, doubt the intent of this issue. But I've seen immunotherapy develop. I've seen continuous glucose monitors get developed. You know, I have a sense of the innovations, and I've often told my friends in the business of healthcare, talk about your failures as much as your successes, so that people understand the give and take in there. And I'm just interested in how, you know, many of the constituents that you worry about their healthcare, how do we both up the game for them, make it about them? But I'm also interested in how we educate people, as well as about, the wins and losses in healthcare?
Communicating, going out into the communities, engaging, especially constituents as elected officials. Go out into the community so that you fully understand what they're struggling with. Not only, again, COVID has lifted the veil on so many problems directly related to lack of access to care and how people are waiting so long to seek services because they feel that they can't afford. So communication, talking with people, when everyone had to make appointments, for example, on the internet, that's when we just went, into action because people didn't have access to internet. So just basic communication. It sounds simple, but it is important. Melissa talked about show and tell. We invite electors to come out to see the work that we're doing in the community through the vans, through the distribution of literature. And that encourages them to provide money for preventive programs and education in the community. So it gets all tied together in order to impact the lives of the people we want to, serve out there. So come out, look, listen, engage, and I think it will make a big difference, hopefully, in how to create more political will and then, establishing policies and budgets to get a lot of this done. It's doable.
Well, I love show and tell. Thanks again to Kevin Fahey for that question, but also thanks to Dr. Irfan Asif, Associate Dean of Primary Care and Rural Health with the University of Alabama at Birmingham School of Medicine. I hope you'll come back. Great conversation. Virginia Fields, founder and CEO of the National Black Leadership Commission on Health, and also the former president of the Borough of Manhattan, which I just think is so cool. And Melissa Schulman, Senior Vice President of Government and Public Affairs at CVS Health. Thank you so much for joining us.
Thank
you.